passage in the House and then to President Biden's desk for signature. And here's what I'm here to do, to answer some questions sent in by folks across the state of Georgia about what's in this legislation, what it means for you and your family, what it means for you and your family's household finances, what it means for the ongoing fight against COVID-19, the public health effort. And look, here's what I'm going to try to do. I'm going to try to break it down for you as simply as I can, what this legislation is going to mean for you. Where I need to ask my staff some questions or refer to notes to make sure I'm getting you the most accurate information, you may see me do that. There may be some questions I want to take for the record and come back to you to make sure I'm getting you the most accurate and complete information possible. What this is about, y'all, is building a direct connection between your representative in the Senate and you and your family. This is about open, accessible, transparent government. That's what I promised running for the US Senate. Right now, given the public health situation, we are sticking to virtual town hall meetings like this one in order to protect public health and slow the spread of COVID-19 since we are still in the midst of this pandemic. As soon as it is safe to do so, we will take these town halls on the road. I look forward to seeing you across the state, to discussing public policy, to discussing legislation, to hearing what I can do for you. I work for you. I'm here to serve you. And every day in this job in the US Senate, when I get to work, I'm thinking about you. And town hall meetings like this one are a great way for us to connect. We'll be doing a lot of this. And if you have a question for me, just put it in the replies, drop it in the chat, drop it in the comments. We won't be able to get to everybody, but we will answer as many questions as we can in the time that we have. And there will be many more opportunities for us to connect moving forward. So before we move to the questions, let me just give y'all an overview of this legislation. This is the American Rescue Plan Act. We had 30 hours of debate. We were debating amendments on this bill from about 10 a.m. on Friday morning straight through until about 1 p.m. on Saturday when we passed this bill in the US Senate. And this bill really has two main components. This bill is an economic rescue and stimulus package. And this bill is a huge investment in the public health effort to defeat COVID-19. So think about it in those two large buckets. When it comes to public health, for example, funding for vaccine supply and distribution to make sure that every single Georgian and every single American can get the COVID-19 vaccine free of charge. The Biden administration has already done a remarkable job streamlining and coordinating a national vaccine distribution effort, working with producers to ramp up supply and cooperation across the production base, working with governors and state governments, working with private facilities in order to expand supply. This legislation will help fund that effort. For example, here's something that you need to know if you're in the metro Atlanta area. State Farm Arena, which many of you used as an early voting site in the 2020 election, will shortly be opening as a vaccine center that can administer 6,000 doses of the COVID-19 vaccine per day. This legislation is going to help us do that. That's Mercedes-Benz Stadium here in Atlanta, which will be a vaccine center capable of supplying 6,000 vaccine doses per day. There will be more such sites opening around the state. This legislation is going to help us bring all of that vaccine production online, coordinate the distribution, and we are currently on pace to be able to get every adult in the country that COVID-19 vaccine by late spring, early summer. This legislation is also the most substantial economic relief package for working and middle class Americans in the history of the Republic. Let me just say that again. This is the most substantial economic relief package for working people in this country ever passed by the United States Senate. 90% of Americans are going to qualify for the stimulus checks or the tax credits. 0% of the tax credits or the stimulus checks go to the top 1%. This is a profound difference in economic philosophy. This legislation is about economic recovery from the bottom up and the middle out by getting more cash into the pockets and bank accounts of working class people, middle class people, and working families. On the economic policy side, you've got the stimulus checks at $1,400 per individual. That includes $1,400 per child. That includes $1,400 per adult dependent. So college students, for the first time, will be eligible for those checks. It's a huge increase, and we'll get into some more of this when we get to the question, but a huge increase in the child tax credit, the child allowance of $2,000 increase per child, so that children under 6 will qualify you if your income is up to $75,000 per individual, $150,000 per household. You got a child under 6, your child tax credit will be $3,600 per child under 6. Your child tax credit for kids over 6 will be $3,000. Also, a big increase in the earned income tax credit for low-income individuals and households, even if they don't pay income taxes, to get credit back from the IRS. We will get into that in more detail. I want to take the first question now because this is the other big piece of the economic policy. Tiffany from Atlanta asks, please tell us about what is in the American Rescue Plan that impacts Georgia. Tiffany, thank you so much for the question. I've just walked through some of the public health, some of the economic policies. But I want to tell you a little bit more about what's going to come to state and local governments in Georgia and to the public school system in Georgia. And let me just give you a little bit of backstory, Tiffany, on how this policy evolved. Within the first few days of taking office in the Senate, I called mayors of medium-sized cities all the way down to small towns across the state. And I called county officials across the state. And I said, what does your community need that you didn't get in the CARES Act? And overwhelmingly what I heard was that the federal government had left smaller communities, smaller localities and local governments out. A huge amount of the money went to Atlanta. A huge amount of the money went to the state. But who was left out? Towns, counties, and cities like Savannah and Rome and Augusta, because under the CARES Act last year, if a locality had less than 500,000 residents, it got no direct federal support. So we set out to change that, working with colleagues in the Senate. Senator Warnock and I set out to make sure there would be direct economic support to local governments for those smaller localities, for cities like Savannah and Rome, for rural counties that need help. And I want to just sort of illustrate what that means. What does federal support for a local government mean to you? Well, that means that your fire service, your police department, all of the local governmental services can be sustained at a time when local governments have taken a huge hit because of all of the unforeseen costs associated with this COVID-19 pandemic. It means that those local governments won't have to lay people off and can keep people doing those vital public services. So this legislation has more than $8 billion for state and local government in Georgia, which is about double what Georgia got in the CARES Act. And then here's one of the things that I'm most excited about, Tiffany. This legislation includes $4.5 billion for public schools in Georgia to reopen safely. That's on top of the support for state and local governments I just talked about. $4.5 billion. This is the first time that the federal government, since the beginning of this pandemic, has made a really substantial investment in public schools across the country. We fought to make sure Georgia gets its fair share of those resources. $4.5 billion to help Georgia schools reopen safely, get kids and teachers safely back into the classroom so that families can get some normalcy back, so that families don't have to keep paying these extraordinary childcare costs. All right, y'all, so I just want to take it back to the big picture for a second, and then we're going to move on to a question from Nakia. You got the huge investment in public health, vaccines, community health centers, right? Rural clinics, clinics that serve underserved parts of our state. You've got all of this direct economic relief for working class and middle class individuals and families, the stimulus checks, the child allowance, the earned income tax credit. Then you've got billions of dollars for our schools to reopen safely, and billions of dollars for our state and local governments to sustain services. This legislation, for example, has $8.5 billion for rural hospitals nationwide. You know, here in Georgia, we have lost 9 rural hospitals in the last decade. This legislation has $8.5 billion for rural hospitals across the country, including ours in Georgia, to help keep them on their feet at a moment of crisis. And then I want to tell y'all about something that Senator Warnock and I really went to bat for. We secured in this bill $2 billion for the state of Georgia to expand Medicaid. The state of Georgia, as y'all know, is one of just very few around the country that has refused Medicaid expansion. And that's denied hundreds of thousands of Georgians affordable health care. So Senator Warnock and I made sure that this legislation has $2 billion, $2 billion to incentivize the state of Georgia to expand Medicaid so that low-income and working-class families can, through Medicaid, get health insurance for themselves and for their kids. Tiffany, I hope that gives you a bit of a sense, and really, we're just scratching the surface. There's so much more I'd like to talk about. There's hundreds of millions of dollars for transit systems to help them recover, something like $400 million for MARTA alone in this legislation. There is a lot of good stuff to help Georgia rebuild and recover. And my office, Tiffany, will release more and more complete fact sheets as we determine what each area of our state will receive, and to help you break down what's coming to you and your family. The next question is from Nakia in Augusta. Nakia asks, what relief does this plan have that will help working class citizens on the front line who make $12 an hour? Nakia, thank you so much for your question. This last year, I know, has been brutal for working people and people who don't earn the wages that they deserve in this country, for working class Georgians and working class Americans who are forced onto this treadmill of debt and financial precarity and low wage work and ill health, especially in a state that's refused to expand Medicaid. All of the child care costs that have piled up with schools closed, the rent and utility bills, the car payment, all pushing working people who already had difficulty making the household budget work into an even more stressed position. And so, Nakia, I want to walk you through the direct economic relief one more time. Yeah, I'm just trying to break this down for you as simply as I can so that you can kind of write some of this down and get a sense of what will be coming to you and your family. And I'm doing my best to make sure that I'm as precise and as accurate as I can be. And if I get something wrong or if I leave something out, my team will put it out on social media, on the website, to make sure you've got all the right information. But here's the direct economic relief broken down for you again. You've got stimulus checks, child allowance, earned income tax credit. The stimulus checks are $1,400 per individual for the first time, including adult dependents. So, for example, for a family of 4 with 2 kids, that's $5,600 in stimulus checks. And the income thresholds for that are up to $75,000 per individual, $150,000 for a couple filing jointly. And then there's a little bit of what the policy wonks call a taper, meaning you still eligible up to $80,000 per individual and $160,000 per joint filer. The amount comes down a little bit. Okay, that's the stimulus checks. Then you've got the child allowance. Okay, and here's the eligibility for the child allowance, also known as the child tax credit. It's $75,000 for a single filer, $150,000 for joint filers. This is one of the most profoundly important parts of this legislation. This provision, which hasn't gotten as much attention as the stimulus checks, is one of the most substantial economic aid policies ever passed to help working families in the United States. $3,000 per child over 6 years old, $3,600 per child under 6 years old. So as you look at your own household and do the math and figure out what that means for you, again, you're adding up the stimulus checks at $1,400 per individual, including kids. You're adding the child tax credit, child allowance. And then there's also the earned income tax credit for lower income individuals and households. And my team will publish those exact amounts. If you don't have kids and your income's under $15,000 annually, you qualify for the earned income tax credit. If you have kids and your income is at approximately or below $40,000, depending on if you're filing individually or jointly, you qualify for the earned income tax credit. That's additional financial relief for you. Now, you're probably asking, okay, what do I have to do to get these funds and when will they arrive? I know this is a lot of information and a lot of numbers, y'all, and again, we're going to break all this down for you, but I'm just trying to communicate what really matters to you and your family right now. Your eligibility for the stimulus checks will be based upon your most recent filing. Let me give you what the income thresholds are again. $75,000 per individual, $150,000 for joint filers for the $1,400 per individual stimulus checks. And if you're at 80 per individual or 160 for a joint filer, up to that amount, you get a decreasing amount, but still some amount in the stimulus check. So it will be based on your 2019 filing that you filed last year. However, if you lost your job subsequently, if you lost your job last year after you filed your taxes, you are still going to be eligible for this money. You will be eligible for this money based upon your 2020 filing if your income took a big hit since 2019. So don't stress that if you lost your job after April of 2020, because it's based on the last filing, you won't be eligible. You will be eligible. We are working with the IRS and the Treasury Department to get the exact details on how you go ahead and request the funds. And I'll make sure that we blast that out far and wide once we have it. The child tax credit, the child allowance, again, $3,000 per child over 6, $3,600 per child under 6. Income thresholds, $75,000 individual, $150,000 joint filers. Those will be on your 2020 taxes that you file in April of this year or before, and it will be paid in a few installments after your filing date. And again, we're working with the IRS, the Treasury Department, and the White House so we can get you the details of how those will be paid out and when you can expect them as soon as all of those details are worked out. Nakia, the other thing I want to just mention is this legislation includes mortgage assistance. It includes child care assistance. It includes several other forms of support that can really help you in the situation that you're in and which you access via state government, but with federal funding. Look, I know that it is very complicated and frustrating when you're already short on money and short on time to navigate that state level bureaucracy, which isn't always the most responsive, and access this assistance. Let my office help you with that. We're here to help you access these federal benefits. I'm going to ask my team right now to put up on the screen how you can get in touch with my office so that you, as working people without time to surf the internet and figure all this out, can call us and get help getting this support. My team will put that information up in just a moment. Nakia, I hope that that gave you a sense of, there you go, ossoff.senate.gov/contact. Nakia, I hope that gave you a sense of some of the help you can expect. Much love to everybody in Augusta. Our next question is from Nicholas in Calhoun, who asks, how does this bill impact college students who have not previously been claimed as dependents and not received the previous stimulus checks? So, Nicholas, let me just be very clear with you about what this legislation does for the first time. Unlike any of the bills that were passed last year, adult dependents are eligible for the stimulus checks. So, Nicholas, if you are 23 years old and you're, full-time at Mercer, or whatever your situation may be, when your folks file, they can claim you as an adult dependent, and the $1,400 will come to them. And that's also true for adult dependents who are in a situation like disability that requires home care, which may make them eligible for filing as adult dependents and so on. But the big change in this bill, and this is something that I expressed a lot of support for within the Senate, trying to look out for students and young people, is that adult dependents, college students, you're going to be eligible for the stimulus checks on your family's filing. Okay, Satchel Williams is tuning in on YouTube, and he asks, how do you plan on aiding African Americans in low-income areas with regard to vaccination? Satchel, that's a great question. I think that it's worth reflecting on what happened in the early days of the pandemic with testing, where testing was really only available to people with power and privilege and wealth when it was low-income people in Georgia, significantly represented by people of color working frontline jobs, low-wage jobs, who were at the highest risk of infection, but couldn't get a test because they didn't have the hookup, they didn't have the money, they didn't have the connections. We're at risk of the same thing happening with the vaccine if we don't approach vaccine supply and distribution, not just from the standpoint of volume, but also from the standpoint of equity. The good news is that the White House and the administration are taking this very, very seriously. And this legislation includes resources to ensure that vaccine distribution is equitable. And that's why I have been working directly with the White House and with FEMA to help determine how we can surge vaccine distribution capacity into the state in underserved areas. This Mercedes-Benz Stadium site, which again is going to be able to administer 6,000 free COVID-19 vaccines per day. For example, given the location of that stadium, that's going to serve the West End. That's going to serve English Avenue. That's going to help serve a lot of West, Southwest Atlanta. That's going to help serve a lot of predominantly Black and lower income communities where there is otherwise a scarcity of healthcare services. And we are also working on helping expand that capacity in rural parts of the state and in other underserved parts of the state. And you should stay tuned to the state of Georgia, the White House, and my office as we make you aware of additional vaccine distribution sites to make sure that the vaccine's distributed equitably. And again, the commitment is that this vaccine should be free for all. And this legislation helps us achieve that. We have a question now from Linda in King, Georgia, who asks, what impact will this bill have on the overall economy? And thank you for that question, Linda. And I think here it's also just worth reflecting on the impact of elections, because this was a close vote in the Senate. Voting matters. It's one of the reasons that defending voting rights is such a high priority for me, for Senator Warnock, for other Democrats in Congress. Voting matters, elections have consequences, and that we were able to pass a bill of this size and scope and substance, that we were able to pass a bill that stimulates the economy not by showering corporations and banks with bailout funds and tax cuts, but by putting cash in the pockets of working class and middle class people. That's elections having consequences. Linda, that's an important part of the answer to your question. What impact will this bill have on the overall economy? Look, broadly speaking, there are two economic philosophies represented in Congress. There's the trickle-down, top-down approach. There's the bottom-up, middle-out approach. What we have seen over the last 20 years, over the last 40 years, has been far too much of that trickle-down approach where economic stimulus flows via the big banks, it flows via the big corporations, it flows via the most powerful and wealthy and well-connected people in the country. Remember what happened a few years back when a stimulus bill, a tax cut was passed, where 85% of the tax cuts went to the top earners. In this legislation, 90% of Americans are eligible for stimulus checks. 0% of the stimulus checks or the tax benefits go to the top 1%. 0%. And not only is that the just and right and equitable thing to do in a crisis when it's working class people who need help, that's also the best way to stimulate the economy. Because unlike investment banks, which are going to invest money in speculative financial instruments, unlike the very wealthy who are going to buy luxury goods or services or just put the money in the stock market, these funds are going to working class and middle class people who are going to spend them on family necessities, on services in the local community. And when we link all this together, the emergency economic relief for working families, the $4.5 billion for Georgia's schools to reopen safely, all of the support for local governments to sustain services, the surging vaccine supply, the resources for the CDC, all of this links together to promote economic recovery at the same time that we are bearing down on and preparing to defeat this pandemic. There is light at the end of the tunnel. But I just want to take this moment to remind y'all of this. We are not out of the woods yet. We need to remain disciplined and strong and take personal responsibility to protect ourselves and our families and our fellow Georgians and our fellow Americans by listening to CDC guidelines and following public health advice. If you need any evidence that there's light at the end of a tunnel, just look at what the CDC said today. They said if you've been vaccinated, then it is safe to be in your home in a small group, unmasked with someone who's not at high risk of COVID-19. That's progress, but we can't let our guard down. There is the risk of another wave of this virus. All of this progress can be lost if we don't remain committed to taking individual responsibility for our actions. Wear a mask when you're in the presence of others. Wear a mask when you're in public. Avoid crowded indoor gatherings. Maintain that physical distance. Continue to track closely the advice of your federal and state public health authorities. Don't take it from politicians like me. Take it from doctors and scientists who know what they're talking about. When we listen to their advice, follow their advice, combined with the good public policy that we are making in Congress right now, we will defeat COVID-19, we will recover economically, and we're doing it by providing economic relief to ordinary people and working families. All right, y'all, we got time for one last question in this town hall discussing the American Rescue Plan Act legislation that we just passed on Saturday. This question is from Sam in Atlanta. And Sam, we touched on this earlier, but I'm glad that you raised it again. The question is, will the bill expand Medicaid in Georgia and help save small town hospitals? And here's the answer, Sam. As I mentioned earlier, Senator Warnock and I went in there and right away got to work securing funding in this bill for Medicaid expansion in Georgia. And we secured $2 billion for Medicaid expansion in Georgia. $2 billion. But we can't do this alone. The state of Georgia now needs to take the enlightened step in the interests of public health, still in the middle of a pandemic. Now that the state's senators and representatives in the U.S. House are going to be delivering $2 billion for Medicaid expansion in Georgia. Medicaid expansion in Georgia is supported by 75 or 80% of people in the state. This is not a partisan issue. This is a public health issue. My wife, Alicia, when she is at Grady Hospital treating low-income mothers who are delivering babies who have unnecessary complications and chronic disease, she sees every day the cost of our state's refusal to expand Medicaid. And that's why Senator Warnock and I went to bat to get these $2 billion for Medicaid expansion in Georgia. And it's now up to our state leaders to take those resources, expand Medicaid, and make sure that no one in this state lacks access to health care because they can't afford it, because health care is a human right. And if that hasn't been clear until now, this COVID-19 pandemic has made it totally clear. And that will continue to guide me as I work on healthcare policy on your behalf in Congress. So y'all, thank you so much for tuning in. I really appreciate it. I hope this helped clarify things for you. I'm sure you have a lot more questions. I'm going to ask my team to throw up, there it is, the contact information again one more time so that you know how to reach out to my office. Questions about the bill, questions about how to access the federal assistance in the bill, questions about anything that you need help with. Remember, I work for you. I work for you. And I wanted to put together this event tonight to be able to give you a sense of what we just passed on your behalf. I hope it was useful. I wish you and your family good health. Better days are coming.